Okay. I'm sorry, Kelly. You wanted us to introduce ourselves?
Yes, I'd like for you to introduce yourself, Christy, and talk a little bit about yourself.
Okay. Well, again, I'm Christy Black. I am the advocacy specialist with the West Virginia Developmental Disabilities Council. Prior to working in council, I was a council member. I'm also the past president, vice president, and a past board member with the Down Syndrome Network of West Virginia. And I also was a former service coordinator for West Virginia Birth to 3. But I also have a daughter I have 2 daughters, one that's 4, Avery, and I have a 17-year-old daughter who has Down syndrome.
Thanks, Christy. Let us move on to Claudia Raymer. Claudia is with Ohio County Family Resource Network.
Yes, I'm the executive director here at the Ohio County Family Resource Network, where I've been for 10 years. Prior to that, my master's degree is actually in special education, and I began working with children with disabilities long before I had my own child who is diagnosed with autism, ADHD, and anxiety. So it has long been a passion of mine, and I'm very excited to speak more about this and get input from people all across the state.
Wonderful. Thank you for joining us, Claudia. And last is Anastasia Riley. She is with the West Virginia University Center for Excellence in Disabilities. Anastasia, you're on mute.
Oh, sorry about that. I do that all the time. I'm Anastasia. I'm with the Center for Excellence in Disabilities. I've been with the CED for 10 years. I started out my career working in Idd Waiver here in West Virginia whenever I was getting my undergraduate degree in psychology and minor in sociology. For about 20 years, I've been working in the field. I've worked in the Idd waivers. I work with at-risk youth. I work now in the positive behavior support program here at the Center for Excellence in Disabilities as the program manager.
Okay, great. Thanks you all for joining us. Let's jump right in with question 1. Developmental disabilities is a term that encompasses a broad range of conditions that result from cognitive and or physical impairments. They're identified before the age of 22 and usually last throughout a person's lifetime. It's an umbrella term that includes disabilities like cerebral palsy, autism spectrum disorder, Down syndrome, intellectual disabilities, languages and learning disorders, vision impairment, and hearing loss. What is it about these conditions that make these children have special healthcare needs, and what makes accessing that healthcare so complicated?
Okay. I guess me first. So, well, I think that all children are unique. And I think that many I think all children are unique, and I think that it's very difficult just because in our area we don't have the specialists or the centers, and I think that also oftentimes different disabilities are predisposed, like Down syndrome, for instance. Many kids with Down syndrome have heart defects and thyroid issues, but not all children with Down syndrome have these issues. So it's finding the specialist and the specialty centers that have the knowledge to treat our children.
And just to piggyback on what Christy's saying, we know, as you said, Kelly, we're a rural state, so access is already difficult. And then when you add, you spoke about some low incidence diagnoses. So it can be even harder when you have a low incidence, deaf, hard of hearing, certain vision impairments. It can be even harder to find even a primary care doctor with enough experience or training to really know how to treat the whole child. Like Christy's saying, a lot of these diagnoses are not just that diagnosis. For example, with autism, it's much more common for a child with autism to have gastrointestinal, so similar to what Christy is saying. But I also think a lot of doctors, they if they're a pediatrician, they don't necessarily look at the whole child, the whole family, and say, what are this child's needs? You know, like Christy said, it's a unique, each child is their own unique person. And something as simple as when you're scheduling an appointment and saying, what can we at this office do to make this visit easier? And sometimes that doctor's office is 2 hours away, 3 hours away. So it's even more important. So I think that hinders access sometimes as well.
Yeah, I agree. I've definitely noticed a lack of in-state resources at times for those specialty clinics, specialty practitioners as well. I know that for Prader-Willi, the closest practitioner was in Pittsburgh. I'm not sure if we have somebody now in the state. And there's so many things that you hear of families traveling so far to get services. And then I know it's got to be hard. We have so many demands of all these physicians, especially these specialty care physicians, but to try to get some collaboration between, get some MDTs for just getting that cross communication between some of these specialty providers, to where, you know, the one issue, the thyroid's going to affect this part of the body, and all these things are interconnected. So we did research on the needs of people with coexisting conditions in West Virginia, and lack of in-state resources was the top barrier. And then, you know, we had wait list, transportation issues, and collaboration is some other identified barriers.
Great, thanks. So we're talking about a lot of different conditions, severity, changes as they age, varying degrees of services available, specifically depending on where you live. We're also talking about different needs depending on condition. And for simply being a person or a kid, you know, you have preventive care like well-child exams and dental cleanings. So can you help articulate what that means and challenges that parents face?
Well, I think some of the challenges, which I think we talked about, is continuity of care. And that, again, is with dealing with different specialists. That can sometimes compromise a child's health if one doesn't know what the other one's doing. Because again, like we said, a lot of times you have to travel. And so you might be going to Pittsburgh for one thing and Columbus for another. And, you know, in our situation, what I do is I keep my child's records and I make a copy for her pediatrician so that at least one person knows what's going on. So if there's ever any question, one professional can talk to the other. I think another issue is some disabilities means that a person's body structure is different. And so a procedure may need to be modified. Just like with my daughter, something that a lot of people don't know, and even some physicians didn't know, is that before she is put to sleep, she has to have a certain type of neck x-ray to make sure that they don't hyperextend her neck when they are intubating her. So I think that's something, you know, well, it's something that I've had to do. I've had to educate physicians about this, but you know, at least it's made a difference for the next child. And one more thing, another issue I know is some children need certain types of exam tables. I have yet to see, you know, my daughter has 7 different doctors, and I have yet to see an accessible table for an older child with a mobility issue.
Wow.
As far as, I just want to touch on what you mentioned about dental care, especially preventive. So the Medicaid is now extended the dental care. And I know up here in the Northern Panhandle, there are a couple of dentists, right? And word spreads like this one knows how to work with family, you know, word spreads, and they're only taking a certain number of Medicaid patients a day. And so it becomes difficult. So like we have the Family and Community Support Grant, so that's available throughout the state. But we used to, because dental care wasn't covered under Medicaid, once they were above a certain age, we were able to fund that. They were getting in a self-pay. So now this unintended consequence, of course, we want dental care for people getting Medicaid. But now what we're seeing is just to get that preventive, the cleanings that the dentists they've always gone to, they're having to book out months in advance. We're not able to pay for that because Medicaid pays for that. So you have these few who are really great at it, and they're so few and far between that the wait lists are just overwhelming.
And another concern that I see, because I work with people who experience a lot of challenging behaviors. And so something that we often hear about are providers that don't want to necessarily see somebody who has a challenging behavior because of the things that could pose in the office. And so we'll hear about like a visit that was 30 seconds long in a car and those kind of things that really aren't getting them the access to that health care, but understandably, the physician is concerned about the stability of their office. So something that I really want to look at is like how everybody communicates, and all behavior communicates a need. And so whenever somebody has anxiety over going to the physician, how we can make this a pleasurable experience, how we can prepare them for that experience. And that's something that we do a lot in the positive behavior support program, is that we'll do something like social stories, we'll do something like role play, or just doing some pictures, getting some ideas going as far as how to reduce that anxiety before a doctor's visit to help them acclimate to that, and so they can get a thorough exam.
Great. So this is a next question. All of you touched on it in different ways. And it's something that we just ask about in the surveying project. You know, whether it be what insurance will cover adverse behaviors, or, you know, keeping medical records intact. These are all kind of challenges that families face when navigating the healthcare system that, you know, adds another layer of complexity when it comes to accessing care. Did anyone warn any of you when you started, you know, traveling down this path of accessing healthcare? Was there somebody to help you and guide you, or did you kind of learn how to navigate the system on your own?
I can tell you that we would have been lost in navigating the system had it not been for the assistance we received from other parents. You know, I joined a support group before my daughter was born. And if it wasn't for them there, you know, I wouldn't have known about early intervention. I would not have known. Matter of fact, I called birth to 3 while I was still in the hospital. I had begged for a social worker, but it was a holiday. So I applied for Social Security for my daughter. I didn't know that I needed to do that. I knew we didn't qualify, but I had found out from another parent that if once we were denied, then we would, you know, we could apply for Children with Disabilities Community Service Program, or CDCSP, which you have to have a Social Security denial to qualify for. And that program does not have a case manager to assist you. And the application process is quite overwhelming. But at the same time, once you get into the system, you have case managers for lots of different programs. So that also can become an issue too, because, you know, you have a case manager for school, you have one for waiver, you have multiple doctors, and then you have therapies, and then you know, you have other children, so, and you have work. So it's sometimes hard to also not only navigate the system and fight insurance companies, but it's also hard to keep up with all the different appointments.
Yeah, and Christy mentioned it earlier when she said, I have all the medical records. I kind of had to laugh because it's like, yeah, as parents, we've got the IEP school binder, and then we have the healthcare binder, and they're both, you know, her daughter is 17, my son is 15. So these are really large binders at this point. That being said, birth to 3 really made such a huge difference for us. Just their approach as family centered was very different. And then you make this transition out, and it's startling, right? Because now you're like, you don't have this person, because there's so many emotions, like you've got this child and you're trying to be the absolute best parent you can be. And you're supposed to just inherently know all these things that you don't know. And the difference is with my son, we didn't qualify for waiver because his IQ is too high. So we don't have case managers, he's not disabled enough, was the feedback that I got. And so when you have a child who is disabled, but has an IQ that doesn't qualify them, the services really are sparse, and the case management services are almost non-existent. So like Christy said, the fellowship of the other parents is often quite literally life-saving, providing not only resources, but that emotional support and feedback, and someone to go like, okay, no, you're allowed to be overwhelmed by this. This is next level, so the support of fellow parents just is I think such a key to navigating this system.
Yeah, just to sort of piggyback on what Christy and Claudia said, birth to 3 is so amazing. There's so many people that once they age out, they're like, what do I do next? Because there are so many red tape hoops to jump through for every service. I mean, just for the eligibility application, where do I go? How do I do these forms? And how the pieces fit as far as service delivery. I think that as a state, we're doing really good very recently at starting to collaborate between different service providers, but really we've had a history of like siloing. Okay, there's this service, and then very separately there's this service. And so I think that makes it extra hard. So I know I've heard a lot of parents say, the parent network specialist, just generally like Facebook groups and the Idd Waiver Yahoo group and those kind of things are so imperative for having that parental support, but also like, how did you apply for this? How did you navigate this system?
Right. So 2 things. I haven't looked into it yet, but I did see during DHHR's budget presentation during legislative session that there was an increased cost of utilization of birth to 3. So it'll be interesting to see what it is that is costing more, and if, why are people accessing those services more. But I think it's great that birth to 3 is providing such a service. If you want to get in touch with parents, you said, is there like an overarching group statewide, or do you need to get on like Facebook and look for yourself?
There's a Circle of Parent support group. I think Tuesdays at 7:00 that I don't think a whole lot of people know about it. I'll try to put that in the chat.
Okay, that would be great. So we'll share.
I think also it's, word of mouth. Parents tend to connect to other parents. I think there's certain support groups for disabilities, out there, but most of them are family or parent ran. And that seems to be where you get a lot of the good information.
Right. Agree. There are a lot of good parents who pay it forward, right? They help people learn from the paths that they had to walk. So let's pivot a little bit. Anastasia had mentioned the Idd waiver. So when we talk about healthcare services for the developmentally disabled, people often hear about the problem of children being waitlisted for services. Is there still a wait list for the intellectual developmental disabilities, or known as the Idd waiver? And do you think it's common for there to be a wait list for community-based medical services and mental health services?
I can't speak for mental health services, but there's always a wait list for Idd waiver. And that's because the Bureau for Medical Services releases slots usually a couple times a year. And, people are coming on every month as they qualify. So they're put on the managed enrollment list. Last year, the legislature did clear the wait list. But again, as people keep qualifying, they're added to the list. But before the legislature cleared that wait list, you were looking at about 10 years or more. And again, that's because parents and advocates fought for clearing that wait list. Wait lists, I think, are common because there's institutional bias. Home and community-based services are not mandatory, but institutional level of care is. So I think that we really do need to educate our families and policymakers about the benefits of home and community-based services. We know that kids want to be included in their schools and in their communities. So I think another big issue is that, unfortunately, many have low expectations for people with disabilities, and sometimes that includes families, and that's because that's what society has taught us. So I think that we really need to educate folks, families, policymakers, and work on changing attitudes.
Kelly, I actually had emailed the state back in March because I wanted to know that exact question. So I can tell you on March 8th, there was a wait list of 85 people. 11 slots opened April 1st and 6 slots opened May 1st. So as Christy said, though, more people have qualified since then. So that's not necessarily to say it's 85 minus those numbers. There is absolutely 100% no hesitation. There are wait lists for mental health services for children and adolescents, even more so when those children have disabilities, because then you're having to see a specific provider. So yes, absolutely, there are wait lists for that. And, that can be hard too, because, if I'm putting on my family resource network hat and I say, and mom or dad or a grandparent, whomever calls me and says, I really need to get my child into mental health services. And then I go, okay, here's my recommendation, but it's going to be 3 or 4 months. Then the likelihood of them taking that child, following through, if they were already reluctant, it just makes it that much harder. So, there's definitely a wait list for Idd waiver, and there's definitely wait lists all across the state for mental health services.
Yeah, I can speak a little bit to the wait list for mental health services. We've always had a wait list for some mental health services, but now with COVID, the pandemic, the mental health effects of the pandemic has hit everyone. And so whenever you already had slim resources spread throughout, and then a greater demand for those resources, it's really, bogged down what resources we did have. So there is quite a long wait list for all mental health services for everyone. And then whenever you layer that with the limited amount of resources we had for people with developmental disabilities and coexisting conditions, it really exasperates it. I know in our program, we're trying to alleviate some of that with just trying to find some efficiencies as much as possible and increased funding to spread our capacity as much as possible, and treating other providers and doing telehealth as much as possible. But whenever there is such a great need, and there is an extreme need right now, just to find as many providers as possible. That's what we really need right now too, is more mental health providers throughout the state.
Yeah, I agree with you. We struggle with that across the spectrum, right? And I have no doubt that once kids, start to transition post-pandemic, especially when they get back to school, there's going to be some need identified, and then where are they going to go? And so just a quick question before we go to our next plan question. How many of you, including me, know somebody who left the state because they needed to access healthcare services they couldn't get here in West Virginia?
think we all know several.
I am one.
Mhm.
I love West Virginia. I work in West Virginia. I care deeply about West Virginia. Family comes first. So we did, I moved 30 miles away to Pennsylvania, where we applied for him to be eligible for their waiver on July 1. He was approved in about 5 weeks. So we applied July 1. Services started September 1 for him. And that included behavior support, social skills groups. Many social skill groups are available. Emergency mobile response services, just a multitude of services. And, we have a lot of bordering counties in this state. So when you have these bordering counties, that their services are just they're much more robust. That was the decision we had to make. And I care deeply about improving it in West Virginia so that doesn't continue to happen, so we can reach the need of the many, many children and families that are trying to navigate a system with very limited resources.
Right. And it's a problem that's kind of outside of, much of it is outside of the healthcare system's control, right? So you're talking about tax base, you're talking about providers, recruiting and retaining. It's such a large problem that trickles on its way down to, families who need to access specialty services. Anybody else want to say anything before we move on to the next question?
I did have a point I forgot to make earlier. I think it was such a beautiful come together whenever we were talking about parents supporting each other. Whenever I know Christy was heavily involved in this, like advocating for the legislature to clear the wait list a couple years ago. And I just think that was so wonderful in so many regards, that so many families came together for that. And I think there were a lot of connections built upon that advocating together. And so I just wanted to say that too as a caveat.
That is optimistic, right? That shows that bringing the power of the people together to, align and move things forward, that, perhaps that can feed into improving the healthcare system. So many families don't have to struggle. And thanks for all your work on that, Christy.
It's personal.
So let's move on to some of the findings that we found from the survey. About half the respondents shared in the past medical providers had refused to provide services to their child for a number of reasons, mainly because they weren't adequately trained or they didn't take their form of insurance. Do you think this is a common challenge that families face? And do you think it's more problematic in the rural setting?
Absolutely. Insurance is a big barrier for us. My daughter, she has my insurance is her primary insurance, and then she has Medicaid through waiver as her secondary insurance. I've had to take my daughter out of state to a specialist because I couldn't find one in state, even a few hours away, that would accept her Medicaid. I even suggested not billing Medicaid. And they wouldn't do that. So again, we have so few pediatric specialists that you can't get in to see one in a reasonable amount of time. So again, you're forced to go out of state. And again, even out of state, you have to make sure that they will accept West Virginia Medicaid or your primary insurance. So I know that it's an issue statewide, and it would have to even be worse in rural areas of the state.
Agree. Anastasia or Claudia?
I think she nailed it very succinctly and right on the head.
I agree. I feel like there are a few more providers being trained in the Not Your Standard Patient program. I know that we have that here at WU Medicine. They, I think, are going to be more equipped, hopefully, with that program. But whenever you have the insurance barrier, it's like, if they are trained, that's great. We want that, of course, but can they still access them? So I think that insurance it seems to be more problematic, as the insurance is a greater barrier, but at least we are getting some providers trained.
Right. I think that insurance has become extraordinarily complicated. I think that surprise billing is always a concern, and I think that I run into people in my work who think that if a child is insured by Medicaid, that Medicaid just covers everything. And that I think is also a hard lesson to learn. And then people always assume that if a provider accepts Medicaid, that means the provider is interested in taking on Medicaid patients. The case. And so it does, I had somebody tell me before, it becomes like a scavenger hunt to try and find the appropriate provider and then ensuring that services are going to be covered. As well as
I have also heard that, they're not accepting any more Medicaid patients. That's another issue.
yes. So we've had, in my work experience, have people say, well, just keep calling that provider, every month and see if they're taking new patients. But, you really can't do that. Time is of the essence when it comes to a child's health. So that's not really an option. So let's move to the next question. What do you think is the biggest challenge for parents to accessing healthcare for their children with developmental disabilities?
I think there are multiple challenges. Again, it's finding a specialist that is familiar or knowledgeable about your child's diagnosis. I think that's the first challenge and probably the most important. And then the second is, how are you going to pay for it? Will that specialist accept your insurance? But how to pay for it is added stress. But I can tell you, as a parent of a child that's has some pretty serious issues, open heart surgery when she was an infant, for one, you'll do anything for your child, and you'll figure out how to pay for it next. It always works out, but it is added stress. It's finding that specialist first, and then it's the financial aspect of it.
Thanks, Christy.
Well, and I think, your type of insurance, the coverage, the treatment, that all varies greatly based on what type of insurance you had. And like you say, they're only able to take so many Medicaid patients a day if you have Medicaid. And then if you have Medicaid as your secondary insurance, like we've had families experiencing more complicated issues than if they didn't, just like Christy said, than if they hadn't had that as a secondary insurance, which, I'll say it again, unintended consequences. And as we've said before, there's not, the insurance companies do have some amazing people that will help you navigate. But sometimes there's such frustration, and there's always already this divide because they're dictating, somebody at an insurance company decided my kid didn't need this thing. So sometimes the last thing you want to do is call that insurance company and try to be like, okay, how, but I do know many of the people who work, there's an insurance company right up the street, headquartered here in Wheeling. And they really do want to help. I think it's just, there's already so much tension sometimes when there have been claims denied, and you don't really, as a parent, there are things I'm like, I don't understand how this works. I don't understand the process of how this works. So really putting out there, maybe more of a face from the insurance company saying, like, we have people who will help you do this. I think that could really potentially make a big difference.
Agree. Anastasia, what do you think?
I think it speaks volumes too that it is so hard to access healthcare. Whenever it's hard, for Christy and Claudia, who are parents and providers and, have so much background and experience in social services that they know the system better than the average person. And so for the average person to access these things and how hard it is to navigate, I think that really just speaks volumes to the difficulty in accessing that care.
I agree. I didn't put any questions in the planning of this, but maybe it's a good time to ask. What differences did you see as your child grew older? I mean, we talked birth to 3. Are there fewer resources as your child ages, or more resources perhaps when they start school?
It seems like for us, my daughter has needed less resources as she's gotten older, but we're getting ready to transition from school. Well, she's got a few more years of high school, but, we're looking at adulthood. And so, I don't know yet what that's going to look like, but what I do know is I'm already hearing, there's certain specialists that's like, you've got to find some, I only see, kids under 18, or, when she turns 21, you've got to find another specialist. And I can tell you, I'm having a little anxiety over that. We've built a relationship with these people. We've grown to trust them, and finding someone else and someone that's experienced with her disability and, some of the more complicated or more unusual situations or diagnosis. It seems like for Gracie, she always gets the odd things, or the not so common things that goes along with her, with Down syndrome. So so I don't know what that's gonna look like as an adult, but it's worrisome. I can tell you that.
I think it's not that we need more or less services. I think I'm much more in tune with what his needs are. So I think we're more focused, or more, able to attend and go, okay, this is an issue. The needs have definitely changed. Like, as adolescence has descended upon us, there are new issues at hand, where when he was very young, again, we had birth to 3, huge shout out to birth to 3. Thank you. And we have that entire team around us, and now it's more fragmented. So it's me, I'm the case manager.
Mm-hmm.
Who's the case? I am. So I think I'm just much more, I'll go, oh, okay, we need to go see the nephrologist. I'm able to look and go. So, and I'm much more in tune with, when does he need to go? When as a younger, I was like, okay, we need somebody to diagnose this. We need to figure out, is it this? And so as they get older, I don't think by any stretch there's less need. Those needs are just different, and are more easily identified by parents, I think, because we've had time to grow, understand the diagnosis, understand our child, know how they communicate, read those signs. We've navigated the system. We're better at that. I mean, just this last week, we had a referral for genetic testing, and it still hadn't come through from the insurance. So I asked the hospital, like, hey, it's been a few weeks now. And they're like, it's with the insurance. Well, I called his insurance company. The insurance company didn't have it. Right. So would 20-something-year-old Claudia have been like, you have not turned it into the insurance. This is not an issue, not that I said it quite that way, but I'm like, oh, I'm not really sure where this referral is. I think it maybe got caught up somewhere. And so Friday, the email back was, we're really sorry. It's going to go out with the first batch on Monday. Insurance says you'll have an answer in 5 to 7 days. So I think as a parent, I'm more efficient in navigating that system, if that answers your question.
Anastasia, you have anything to add on that?
I really don't, in some ways, because I have an 8-year-old and a 5-year-old. They both do not have an identified developmental disability. We did access birth to 3 for a short while with one of my children, with my oldest. But I was thinking with foster parents and parents that would be new to a child, because, you know, you guys know your children so very well growing up with them. But I was thinking of how difficult it might be for a person who would be a new caregiver for someone as they're aging, just to sort of navigate the system. Just a thought, not really anything bad.
You know, every so often I'll hear, I heard this a lot more probably about 10 years ago, but somebody will go to a provider and say something like, well, provider thinks that my child may have autism, but he thinks he'll grow out of it. Or maybe it's a concern once he starts school, and they can help identify if they think that he has autism, without thinking the importance of early detection, early services. Can any of you have any comments on that? Do you think we have providers that need more education around early diagnosis?
Yeah, I've heard some of those same comments actually from parents. So actually some in my own family, some, you know, through birth to 3, I've heard the grow out of it, or the give them time. Don't worry, mom. I'm sorry. You know, I think moms have to go with that gut. You know, moms know. That would probably be the best advice I could give a new parent is you're the expert, or any parent, you're the expert on your child. You know your child better than anyone. No, maybe you don't have a medical degree and there's things like that you may not know, but you know your child.
And we know the importance of early intervention and the difference it can make, even in my own friends circle. And again, like my educational background is special education. So I do come into this with, I did come into parenting knowing a little something, certainly did not know as much as I thought I knew until I had a child. But I was at a gathering with my friends, and my friend's daughter was approaching close to 3 years old, walked up to her mom, lifted up her shirt, patted her belly. And my friend says, oh, she's telling me she's hungry. And I said, is that how she tells you she's hungry? Does she say she's, and this child had almost no language. Like and I said, you know, by this, you know, so it's a casual conversation, because well, I brought it up to the doctor, and my doctor just said, you know, she'll grow out of it. She's got an older sibling, and her older sibling does all the talking for her. The child did end up in early intervention, briefly, but ended up getting the services. Child ended up hearing impaired. So you know, again, you got to trust your gut. You know, here's mom trusting her instinct. Like, yeah, I thought she should really be talking a lot more than she is. But when I asked the doctor, you know, and then there's the old like, oh, they're boys, they develop later. They develop speech later. Listen, early intervention services will come out. It's no cost. They're not going to take your insurance. The richest person on the planet could get birth to 3 services. It doesn't matter. And it's centered around teaching you how to work with your family. So it's really hard, because you're like, well, I'm not a doctor, or the doctor knows. And so you're deferring to a professional, and then you're taught to question your own judgment about things. And that's disturbing, to say the least.
Agree. Okay, so y'all touched on this earlier, but do you think there are any groups or resources in place on the federal or state level to help parents network and mentor with one another through the process, and perhaps collectively advocate?
Again, I think birth to 3. I think many of the service coordinators are very helpful and knowledgeable about resources. Many of them are parents of, you know, children that have delays themselves. The DD Council, we're working on a project of parents as mentors called the Student Success Project. That's a new grant that's just getting started. The DD Council, we also have a program that I coordinate called Partners in Policy Making, which teaches parents of young children and people with developmental disabilities how to effectively advocate and create systems change. So, we're with partners, or PIP as it's called, you end up developing friendships, and often they're lifelong friendships. It's another, group of people with disabilities and family members that kind of end up working together. So it's a way to build those relationships. I know that I'm a PIP grad, and it's most certainly impacted my life. And I know that, I have friendships from PIP as, people I graduated from the program with still to this day.
I think that one thing I've learned over the years is that moms and dads with children with developmental disabilities really learn how to self-advocate. And sometimes they get help in learning it, and sometimes it has to be that personal experience. But it really says something about our system when you have children who are marginalized, whose family members have to be the ones who ensure they get what they need. And I think that that's really shows where we're broken in the system.
Another resource too, for people to learn, and it's more for adults with developmental disabilities, but People First is a great resource, and they do really great advocating, and then building connections within their group too. So that might be another good resource. There's also a parent network specialist. They could help with navigating that system too, because they've been there.
And one more thing I wanted to say, the waiver group in the first waiver rally 5 years ago, that all came about from parents. That was actually myself, Christina Smith of Strive Advocacy, who's a parent, Tracy White, who I met through Partners in Policy Making. She was one of our participants. But that was a parent of 3 children with disabilities. But that's how that all started. That was a huge movement for I think our state and for people with disabilities, that was a governor. Yeah, it's been 5, almost maybe 6 years ago. I mean, we had close to 2,000 people on the Capitol steps advocating for waiver services. That was about not cutting waiver services.
Mm-hmm. It was amazing. It was one of the largest groups I had seen at the Capitol. So kind of feeding into that, what would you suggest to parents or caregivers who are struggling to access healthcare for kids? Do you have any advice on first steps?
Again, I would say don't give up. Don't give up. Remember, you're the expert. You know your child better than anyone. Speak up. Seek out other families who've had similar experiences. I've yet to find a parent that won't help another parent or tell them, their story or their experiences, so that other people maybe they don't make the same mistake, or, to again, tell them the positive experiences or of how to access, whether it's care or services or supports.
I would also say, when it comes to some of the medical, I mean, there are people, there are professionals, there's parent network specialists, there are professionals that can assist, there are people at your insurance company that can assist. But ultimately, like Christy is saying, don't be afraid to ask questions. Even something as simple as I got an email asking about, why is the school pushing so hard for me to sign this paper to allow them to bill Medicaid? Right. And I'm like, because they're going to bill Medicaid for the OT, PT, and speech, and it's just something as simple as ask the questions. If something feels like, I don't understand this, or this doesn't feel right, this doesn't make sense, this feels uncomfortable in any way, ask questions. You know, I mean, you're never going to get an answer if you don't ask questions. And, you know, unfortunately, a lot of things are time consuming processes of having to advocate. But again, you know, as Anastasia alluded, Christy and I both have backgrounds, and you know, we come to this really informed. So we know if we're experiencing this, the experiences of other marginalized populations has to be that much worse, you know.
Mhm.
So call on those other people in the community to help you. You know, we've got your back. You know, we're going to be here for you.
Great, thanks. Anastasia, do you have anything to add on that?
That's a great point. I was just gonna piggyback and say connecting providers as much as possible for increased communication, which is sometimes hard. I mean, there's HIPAA barriers too for them to connect to each other. So being that central hub. There's also, I wanted to share a resource. There's a West Virginia PALS line for pediatricians to connect with a psychiatry, like collaboration or to get some consult for psychiatry. So that might be another good resource for accessing that healthcare and getting that collaboration going. I wanted to speak a little bit too to the school billing Medicaid for some of those therapy services like speech, occupational therapy, PT. I know we've ran into quite a few times where there'll be a child that we're working with and schools providing, say, speech therapy, but there's one ST for the entire county. And so they can only get 30 minutes a month. And that might be a hyper example, you know, but it might be very limited in the school, but then they can't access it outside the school because it's already being provided through the school. So that's another thing, is just like navigating the resources of the if-thens of, if you get this resource in this setting, you know, how can we maximize the amount of services needed and where can you get those?
And feeling empowered to say no to something like the billing for the service. You're under no obligation to allow them to bill when you're having outpatient services in a community setting, you know, so, and that comes with time.
It's education. It's all about, you know, parents being educated.
I agree. And it's all that you don't need to know that you need to know it until you need to know it, right? So it doesn't really resonate until that moment comes when it's information that you need to know. And Anastasia, you brought up a good point. You know, we're in part of this surveying process. We have 6 surveys that we're sending out to parents and caregivers. And then the plan is, after we get some feedback, to go to providers and say, here is what we're hearing. What is your response to this? To see if we can get some kind of dialogue going and break down some of those silos. And I just want to share what the new survey looks like that we'll be pushing on social media starting tomorrow, and it focuses on perception. So do you believe that the healthcare system is responsive and supportive? Do you feel valued as a parent or caregiver? Are you ever concerned that the physician or medical provider has a negative perception about people with developmental disabilities? And so it's just another short survey with some demographic information that we need to collect for our, it's for the federal government because that's the funding source. But it's a very short survey, again, for parents and caregivers to try and learn more about what their experience is to navigating the system, to help inform and elevate those challenges, to try and seek change from policymakers on the state and local levels to improve the system. And so if we can get folks to share that information with us. They can join in any level that they like. So if they just want to join a survey or complete the survey, share the survey, if they want to do like a Facebook Live, like you three ladies have done with us today, or if they want to meaningfully advocate, meaning do they want to come with us when we share this information with policymakers to help educate them and articulate the challenges that you face. So with that, we have 3 minutes. Do any of you three have any parting thoughts you'd like to share?
I just want to also encourage participation in the survey. I know it can be overwhelming when you have a child with disabilities to maybe go to the Capitol or participate in other ways. Certainly, we would love to see, continued in-depth involvement. But, the survey, getting that information is so valuable. But not only completing the survey, but encouraging your friends and neighbors who are in the same situation to also do it. The more information we have, the better. And I know we've all probably seen 100 surveys, but truly this is so specific to what we experience as parents of children with developmental disabilities that I really would encourage everyone just to take the time. It's not long. It'll take you a few minutes and really provide invaluable information.
Thank you. There you go, Christy. You're good. Well, I want to thank all three of you so much for sharing your time and expertise today. And I want to thank everyone who joined us today and watched, whether you're watching live or you'll be watching the recording on YouTube. Keep an eye out for links to all of the resources that folks shared today. We want to make sure you have immediate access to those. And we'll be sharing links again to the survey, the one that's out currently, which we've received about 100 responses to it. And then the next one that we're launching that's specific to perceptions. And we'll have that link on our social media page as well as our YouTube channel. So with that, thanks again for joining us and have a great rest of your day.